My name is Kim Berry, and I'll be demonstrating a Foley catheter insertion today. Before starting my procedure, I would make sure that I grabbed at least a washcloth or two, my Foley catheter kit, and then some extra gloves. When I enter the patient's room, I would perform hand hygiene, introduce myself. Hi, my name is Kim. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay, Mr. Jones, very good. March 23rd, 58. All right. So now that I've verified my patient's name and date of birth, I would check and see if he has any allergies. I would want to raise the bed up to proper working height. And then I'm going to don gloves. And I want to start off with cleaning the perineal area. So, Mr. Jones, today we're going to be performing a Foley catheter to help you urinate, okay? He likes that idea. Alright, so I want to make sure that his legs are moved apart. And I'm going to washcloth with some warm water and some soap. Make sure all of the area is clean. I'm going to throw that in a soiled linen bag. So now I am ready to set up my catheter kit. Remove my kit from the bag. And I am going to use this as my trash bag at the bottom of the bed. So now I can open it up, starting away from me. And I'm going to take the drape on top, put the shiny side down, and place that underneath him. Okay. I'm going to place my sterile gloves over here. I should have taken these gloves off after I cleaned the perineal area. So I'm going to put on my sterile gloves. I would interlock them to make sure that they're secure. And now I can start my sterile procedure. Okay, so I want to get my supplies organized before I do anything further. So I would take my betadine, pour it on my cotton swabs, and I can throw that away. I'd want to uncap my sterile saline and connect it to the port on my catheter so that I can inflate the balloon whenever we're ready. And then I would uncap my lubrication and leave that there. So now I'm ready to begin the actual insertion. I need to first clean the meatus. So now that my left hand is now unsterile, so I'd use this, go around once, and discard. Again with the second one, and discard that. And lastly with the third one, and I can discard all of that now. So now I would lubricate this. I can throw that away. And now I'm ready to insert the actual catheter. So I would have him take a deep breath, and I would start insertion. And I would insert it 7 to 9 inches, or until I got urine flow. Then I would insert insert it another 1 to 2 inches. At this point, my sterile procedure is over, and I am ready to inflate the balloon inside. So I'm going to insert all the water into the balloon. I'm going to pull this off so that the water doesn't exit because of the pressure inside. And then I can tug on this to make sure that it's in the right place. Okay. My right hand is still sterile. I need to open my specimen cup. And I would unhook this, hold it over my drainage bag, and unclamp it. When I got enough of a specimen, I would reclamp it, and I can reinsert it into the covering. Now I'm going to hang this on the side of the bed. And I can attach the catheter to the thigh at that point. Now I can screw the lid onto my specimen cup. I would want to make sure that this got to the lab immediately. I can remove these gloves, throw those away. And now that my sterile procedure is over, I can just don clean gloves to clean up the area. So I would discard all of my materials. I would assess if my patient has any pain, if I can get him anything, cover him back up, and that's it. As I was documenting, I would want to make sure that I documented the amount, the consistency, the clarity, the color, if there's any sediment in the drainage bag, and I would want to make sure that the drainage bag is always below the height of the bladder.